Tube feeding enables you to receive specially formulated nutrition directly into your stomach or small intestine. Just like a well-balanced diet, it provides all the necessary calories and essential nutrients to help you recover and maintain good health. Your dietitian or healthcare professional will choose the right feed that best meets your nutritional needs. Receiving nutrition through a feeding tube may take some time to get used to, but it is important to remember that you can still enjoy many of the things that you have always enjoyed. To begin, clear and clean the space where you will have your feed. Then gather everything you'll need and check it is all clean. You will need a 30 to 60 ml syringe, your Bolus formula, and some water. Now wash and rinse your hands thoroughly. Flushing the tube with lukewarm water before and after every feed or medication is essential to prevent blockages. To do this, simply put the prescribed amount of lukewarm water into the syringe. Attach the syringe to the tube, open the clamp, inject the water into it, and then close the clamp again when finished. You need to be on at least a 45-degree angle during feeding and for at least 30 minutes after. So it's important that you're in a comfortable position. You can do this sitting up in a chair or couch or in bed. Important: feed should never be taken whilst lying flat. This can cause reflux or vomiting, and small amounts of fluid can enter your lungs, known as aspiration. When administering the formula, it is important to remember the following precautions. Do not tube feed if your stomach is upset or there is vomiting. If you have an uncomfortable feeling of fullness, slow down the feeding rate or wait an hour before recommencing feed. Your dietitian will help you determine the method of delivering formula that best suits you. Shake the formula well. Check the packaging for the best before date. Do not use if it is past the best before date. Remove the plunger from the syringe, then put it to the side. Ensure the feeding tube clamp is closed. Place the tip of the syringe into the feeding tube. Hold the syringe and feeding tube upright. Using the syringe as a funnel, slowly pour the formula in. Open the clamp and allow the formula to flow through the tube. The formula is generally given over a 10 to 15 minute period. Refer to your regimen for further guidance on the volume required. Once the feed is complete, close the clamp, disconnect the syringe from the tube, then use the syringe to flush the tube with the prescribed amount of lukewarm water to prevent blockages. Wash your hands, and if you have a reusable syringe, wash the used syringe in warm soapy water and dry it after each feed. Make sure to follow the specific cleaning instructions provided for your equipment. Important: if you start coughing, vomiting, choking, or have difficulty with breathing when you are feeding, cease the feed immediately and contact your doctor. Contact 000 if you need urgent medical help. Please refer to your dietitian or healthcare professional if you have any other problems or need further advice on your feeding regimen. IsoSource 1.5 Cal is food for special medical purposes, specifically formulated for medical conditions where nutritional needs cannot be met through diet modification alone. Must be used under medical supervision.